welcome to Heart Health Month. We are so excited to be with you guys and share with you so much important information. Today, the topic is, do you know the signs of a heart attack? And we're so excited to have Sarah and Jessica sharing a little bit of insight, a lot of insight on heart attacks and just how to stay on top of all of it. So, some of our objectives for today, you'll be able to share with your friends and family what are the signs of a heart attack. A lot of people don't know, so take notes, take out your pen, take out your paper. And that way, if you're ever experiencing a heart attack or someone around you is experiencing a heart attack, you'll have some notes on it. How can you react when you think someone is having a heart attack? What is You're the Cure? So we're going to hear Sarah talk to us about You're the Cure and how you can make a difference in your community. So with that being said, I'm going to pass it on to Jessica, and she's going to talk to us about heart attacks.
Hi everyone, my name is Jessica Santana Toro. I am a nurse, a registered nurse, and I specialize in a cardiovascular flow over in a hospital. So I got to a lot of insights about a heart attack and a lot of things, especially education in regard to taking care of, our heart. So for me, it's a pleasure to be here and pass you all these nice informations and powerful. So I'm going to concentrate on the heart attack. Okay. So about every 40 seconds of Americans has a heart attack. And so it happened very, very often. Okay, so probably a member of your family or friends you heard about having a heart attack and they're not knowing what are the signs and symptoms. Therefore, we're going to talk about it and you guys going to be very good and educated about what to do and what are the symptoms. So the good news about that only 40 seconds of an American get a heart attack is that every year tens of thousands of Americans survive heart attacks and go back to work and enjoy a normal life. That is really good news. So our program objective, by the end of this lesson, you would be able to share with your families and friends some of the causes and warnings of the signs of a heart attack. What to do if you think someone is having a heart attack and the difference between a heart attack and a cardiac arrest. So heart disease is the number one killer of our Americans. People of certain ethnicity often have more heart attacks, such as 1 out of 4 African Americans die from heart disease. 1 out of 6 American Indian, and Alaska Native die from heart disease, and 1 out of 5 Latino die from heart disease. So, for us to learn about the warnings and signs of a heart attack, I'm going to be talking about the list of signs that you get when you have a heart attack. So first, you start with discomfort in the center of your heart, of your chest, and it feels like uncomfortable pressure. It's like a squeezing sensation, fullness, or pain. A lot of people express their feeling as an elephant in their chest just because it feels very heavy. And most of my patients, they have described that like that. The symptoms last more than a few minutes. It goes away and come back. So it's not something that it stays there for a long time. It comes back and goes away. The pain or discomfort it can be in both one arm, that back, neck, jaw, or stomach. You can have shortness of breath, fatigue, with or without chest discomfort. And also you can break up in a cold sweat, nausea, and feeling lightheaded. For women, it could be different, right? The woman can experience heart attack without chest pressure. And the more often symptoms in women may be shortness of breath, nausea, vomiting, pressure in the lower chest, upper abdomen, jaw, neck, and upper back pain. It could also have dizziness, lightheadedness, and extreme fatigue. As you can see in this slide, it talks about what are the causes of a heart attack. And it shows how it has all this artery in this heart. However, the main is that when there's a block on any of these artery, it does not provide the oxygen that your heart needs. And that is actually what it causes the muscle to have that issue and cause a heart attack when it's blocked, one of these artery. I don't know if you can see it, but I can see it over here. Okay. And a lot of people, I want you to be honest, but in reality, a lot of people they don't know the difference between a heart attack or cardiac arrest. So therefore, I'm gonna give you a simple explanation right here. A heart attack is a circulation problem, which is basically is a blood flow of the heart that is blocked, just like I explained the previous slide. One of those are when it's blocked. On the other hand, cardiac arrest is electrical problems, and the heart stopped working suddenly. So it stopped beating, stopped working, and so a heart attack may cause a cardiac arrest. So either or, but they both a bad problem. For cardiac arrest, we already spoke previously about the heart attack. Now, the warning symptoms of the cardiac arrest is that there's a sudden loss of responsiveness. The person doesn't respond, even if you tap them hard on the shoulder or scream their name or ask them loud, are they okay? The person doesn't move, speak, blind, or otherwise react. There's no normal breathing, and the person is probably only grasping for air. So in that case, and in that incident, you just need to call 911. And what I always recommend to people that if you are with someone, just let them to call 911 while you can do a hands-on CPR. You need to push hard on the chest, on the center of the chest, and push as hard as you can so you can save that person life while the other person is staying online with the dispatcher until the dispatcher tells that it's okay to hang up. So like I already mentioned, don't worry about it, call 911. Don't wonder if if you need to pay it up in front for the ambulance, if you get in trouble, or if you need an ID card for an emergency medical device to help you. Don't wait, please call 911. Please take this easy step to save a life, okay? Before if there's an emergency, please just learn about the symptoms of a heart attack, right? And also, find out what hospital in your area has a 24-hour emergency cardiac care. And also, always call 911 in emergency, including situation where someone is unresponsive and not breathing normally, only gasping. One of the main things that I always educate my patients about how to reduce the risk of heart attack is about telling them the A essential to reduce this risk, right? First of all, you stay active, get active. Is that if that's the case, right? Move your body, walk, right? For the second point is to eat better, eat less processed food, good fats, right? And lower your salt and low saturated trans fat. Lose weight, keep your weight under control. It's very important. Stop smoking, avoid other people smoking around you as well. Control your cholesterol, control your blood pressure by taking your medications, exercise, eating healthy. We already mentioned that. Reduce your blood sugars, which is really, really, really important, and control your blood sugar if you have diabetes, and get adequate sleep. Sleep is important to stay healthy, and also for kids, is required to sleep more than 7 to 8 hours. Learn the warning signs of a heart attack and cardiac arrest is one of the call to actions, and I encourage and I empower you that are listening to this recording to learn the warning. Is very important. You can save life. If you see someone with a warning of a heart attack, please don't wait. Call 911 immediately. And also just listen to those preventions that I already mentioned about taking and reducing this risk of a heart attack. So now Sarah is gonna talk to you about You Are the Cure. So I'm gonna stop really quick, and she's gonna go ahead and go back to the slide.
Yes, hi. Thank you, Jessica. That was excellent information, and I appreciate hearing it from a cardiac nurse. I think what you do is really important, and you've probably seen some cases where people put off their warning signs and they didn't want to call 911 or go to the ambulance, and so it is so important to act fast and save those minutes, like you said. Life is important and those minutes count. And so don't wait. I think that's a great takeaway for your lesson today. I'm a nurse also. I'm a registered nurse. I've been a nurse for 15 years, and I have not worked the cardiac floor, but I've worked in the hospital and I've done a lot of home health care. And my passion is really educating people. That's what a lot of nurses do in home health, is teaching patients and families to manage their conditions, to stay out of the hospital. And so my part of the presentation today is just, again, to educate, but also to empower you as a viewer, someone who is interested in learning more about taking charge of their health and making a difference for both yourself, your family, your friends, and your community. There are ways that you can get involved in the community and help spread awareness, similar to what we're doing today. So I'm just going to talk about one of those ways that you can get involved and really start to get active in spreading education and awareness to improve health. So Empowered to Serve is an initiative by the American Heart Association. The American Heart Association provides Empowered to Serve health lessons. And so our content today on the warning signs of a heart attack came from this Empowered to Serve initiative. So they provide all of these resources on the website at the American Heart Association. You can access this information to go back and review for yourself, to share with your workplace, with your church, with your community. So these materials are available to you, they're online, and you can use them at your leisure as well. Programs by Empowered to Serve is called You're the Cure, and it is a grassroots effort to address important health issues. Heart disease is America's #1 killer, and stroke is the #5 cause of death. The You're the Cure also works to ensure access to health care, so making sure that there are clinics in underserved communities, making sure that there are ways for people who are uninsured or underinsured to get health care that they need. And then a third way is to improve the quality and value of care. So issues that we want to all work to see changed in our community. And one way that you can be involved physically and actively is to join You're the Cure. One way that we promote healthy policies in the community is to promote policies that improve health. Examples of that would be tobacco and stop smoking education programs, programs that encourage kids to not start vaping, things that educate and provide resources for schools to educate and provide posters or guest speakers. Those kinds of things would be involved in the healthy policies. You're the Cure also supports access to healthy foods through SNAP programs and access to clean water. A final way that You're the Cure works to promote access to healthy policies is increasing funding for prevention programs. So they work with lawmakers to advocate in city budgets and state budgets and on the federal level to give funding for those programs that are needed. A way you can make a difference in your community is to join the Cure, like we said. Join You're the Cure. And you can start today by taking action on issues that affect your community and the people that you know. Once you join You're the Cure, spread the word and start getting involved. Again, when we all work together, we have a bigger voice, and your voice matters. This is a picture of some You're the Cure members that met together at the Capitol to work on policies for their cities and their states, coming together and joining together as a group to speak up for what's important for your family and your friends and those that you know is a great way to get your voice heard and to make change that will really affect your community. So again, we can use your voice to create healthier communities. You can help the American Heart Association and Empowered to Serve draw people together on a path that will build a sustainable culture of health. So improving the culture of health in your community is so important, and it's such a great thing to get involved in. If it sounds like something that you'd like to do, we'd like you to sign up today to become an ambassador for your community and learn how to be a part of the movement. So that is all I have on my You're the Cure. Again, you can just go to you'rethecure.org to sign up and get active today.
Awesome. Thank you, ladies, both so much. So much rich information. I was actually taking screenshots for family members on some of the slides. I was like, I'm going to send this. This is important. But with that being said, there's actually a few questions I'm going to throw in your direction and see if you have any answers for us. So the first question that I have here is, how early in life should people
That's a
worry
great
about
question.
cardiac
Jessica?
arrest?
I mean, it's important throughout life to maintain good health and stay active. That's why I'm a good advocate from early age. My kids, like when they born in the house, I say you need to go running. Let's do something, because prevention is the main key. And obviously, heart attack is mostly happening to sometimes early 30s. So I believe, as soon as you can start developing a better nutrition and lifestyle, I mean, it will not harm. So from that, if you encourage kids early age, they would have like a judgment how to keep moving. Healthy lifestyle is gonna guide them throughout their whole life. Therefore, it's always good to start early.
Awesome. So, another question that we have is, how does my family history
I'll
affect
start
my
that one
heart
on
health?
then. Yeah. Family history
Sorry,
is really
you have
important.
the
One case that comes to mind is the trainer from The Biggest Loser. I don't know if you guys watched that show, but Bob Harper, he is in perfectly physical form. I don't know if his body fat is like 5%, but he's a personal trainer, eats great, works out, and as far as I know, doesn't have any habits such as smoking that would increase his risk, yet he had a heart attack at a young age, maybe I think his 40s or 50s. And so that's a great example of how genetics can play a role in the heart disease. And so it doesn't necessarily mean that you're going to suffer from heart disease or that you will have a heart attack because your father or your grandfather did, but it's definitely a risk factor, and it's definitely something to be aware of and to keep in mind. And so if you know that you have a mother or father, a sibling, or a grandparent with a heart condition, high blood pressure, heart disease, or a history of a heart attack, that does increase your risk, and you want to be extra careful to follow those preventative essential 8 things that were on the slide, those lifestyle habits, the good nutrition, the keeping your cholesterol intake down, and just stay on top of your overall health and the prevention aspect of what you're doing so that that genetics is kind of mitigated or balanced out by your good health habits. So I would say yes, it's important. It's not anything to be scared of. It's not anything to cause increased anxiety or worry in your life over, because of course stress and anxiety are not good for your health either. But it is something to keep in mind and know that if you have a family history of heart conditions, that can be genetic and it can affect you. So talk to your doctor, get a checkup from your doctor, an annual physical, let them do your lab work, let them check your cholesterol and talk with you about anything that they notice early, because early intervention is important. Being on top of any kind of warning sign and intervening early is going to be great for the long run. So those are some tips and things to keep in mind.
One last question that kind of goes hand in hand with that. And the question is, if I'm feeling shortness of breath and some of the heart attack symptoms, should I go to the doctor right away or wait it out? So if I'm feeling some of the heart attack symptoms, but not all of them, should I go to the doctor right away or wait it out?
Yeah, I don't mind. I think that's an excellent question. And it really depends on the case. So I say if you are having difficulty breathing, that's an always call emergency help situation. It could be something else. It could be something as Sometimes with a significant panic attack, you can't breathe and you have chest pain. So it could be something like that, or it could be something very serious. And so you don't want to wait. You want to err on the side of caution. And so the shortness of breath for me is a sign or a symptom that you definitely want to get immediate help for. The other ones, kind of on their own, such as the nausea, or if you just feel dizzy and lightheaded, or if you just feel soreness in your shoulder, those are not as emergent. So if they are, I would say, alone, if you're just feeling those symptoms alone, they're less concerning. If you're feeling 2 or 3 of them all together, that is more concerning. So for instance, if you're breaking out in a cold sweat and your arm hurts and you have nausea and dizziness, that's concerning. I would probably go ahead and call for help. And it also depends on if you're alone or not. If you're alone, it could be more concerning because there's no one there. If you do have something going on that's a cardiac event, and we learned from Jessica's presentation that a heart attack can cause cardiac arrest. If you go into cardiac arrest and you become unconscious, there's no one there to intervene for you and to call 911. So if you're alone, I would say it's more concerning. You probably need to get help right away, rather than if you're with your mom or a friend or around people. Let's say you're at your office and you're having these symptoms. You could maybe wait a few minutes, 5 minutes, and see if they go away, and it was just something that triggered a physical response that you're experiencing. So it's very hard to say. I don't give medical advice. I'm just a nurse. But I can say that if you have just one of the signs, like Stephanie said, if you're just having one of the signs, if it's not shortness of breath, you could probably wait it out and also kind of make a determination on how serious or severe the symptom is. If it's something light, if it's not mild, I would say if it's something mild and it's not interfering with your activity, then it's not as concerning as something that causes you to stop what you're doing and go, wow, I've never felt anything like this. This is, you'll trust your gut. Your gut will tell you if something's wrong or not sometimes. So that's what I think.
Thank you so much. These answers were so good, and I'm excited to hear next month more about the nutrition piece. I know next month is Nutrition Month, and we're gonna go in deeper. I know Jessica's gonna lead us on that one. And you guys touched on it today, so I'm excited to invite everybody back. We're just gonna keep diving deeper, and our goal is that you learn and you share what you learn with others as well. So thank you guys so much for connecting, and we'll see you again next month. Bye.